super energetic Satyakant is here. Amrit, you have competition now. Share the slides, please. So the host has muted everyone. The panelists can unmute themselves. Let me welcome you to this 140th edition. Now, a very practical topic. Actually, you might be sued if you do not listen to us today, because today we will be talking about preventing and handling litigations. So next slide, please. I'm handing over the session to Professor Dr. Tufan Pati sir. Sir is the chairman of this program. He is very well known for his organizational experiences, allowing us to work freely. Sir, over to you.
Thank you, Dr. Alim. Welcome everybody to this Thursday musing of today, and that is a very relevant issue, the legal problems to be discussed by Dr. Ravis. And next slide, please. I have the pleasure to introduce Dr. Amrit Patidosi, Professor of Psychiatry in High-Tech Medical College and President of Indian Psychiatric Society, Odisha State Branch. And he had been a direct council member of IPS and is vibrant in many fields everybody knows, and welcome. And Dr. Alim Siddiqui, Professor of Psychiatry in Eras Medical College, Lucknow. He is the treasurer of IPS, having all the money that IPS has. And he's the vice president of IMA Lucknow and editor-in-chief of Indian Association of Biological Psychiatry. Welcome, Dr. Alim and Dr. Amrit, our vibrant moderators. Next slide, please. Dr. Paneer Selvan, our chairperson from Tirunelveli, is director and senior consultant of psychiatry of Sneka Mind Care Hospital, Tirunelveli, and founder of Tirunelveli Kanyakumari Tuticorin Tenkasi Psychiatric Association, TKTT. President-elect of IPS Tamil Nadu chapter, chairperson of Machine Learning and Artificial Intelligence Task Force of IPS, chairman of Membership Drive Committee of Sao Jona IPS, worked as a research scientist of the ECT project in MANS, as national and international research publications, a good number of research publications. Welcome, Dr. Selvan. Next slide, please. I take the pleasure to welcome Dr. Abdul Mazid from Srinagar, the professor and head of the Department of Psychiatry of SKIMS Medical College, Srinagar, president of IPS North Zone, convener of CME Committee of IPS and IHMH, co-chairperson of Disaster Management Task Force, South Psychiatric Federation, honorary general secretary of IHMS 2018 and 2022, direct council member of IPS, International Distinguished Fellowship of American Psychiatric Association, many national and international papers, including book chapters, presented research work in many national and international forums, has been collaborating research work with researchers of various prestigious institutions like Douglas University of Canada, PGI Chandigarh, AIMS New Delhi, and NIMS Bangalore, recipient of National Award of Excellence in Mental Health and Disciple Award of IPS North Zone, Shwacheta Tiwari Memorial Award of IAGMS, Glory of India Award, and so on. Welcome, Dr. Mazid. And now over to Dr. Selvan and Dr. Mazid to conduct this program. Please take over. One has to introduce the speaker and the other has to introduce the topic and show him over. Welcome, Dr. Mazid and Dr. Selvan. Please take over.
Dr. Selvan, may I start?
Yes, sir.
Yeah.
Respected Chairman Dr. Topan Pati and moderator Dr. Ali and Amrit Joshi, today's speaker Dr. Ravish and co-chairperson Dr. Abdul Majid, and my dear senior colleagues and audience on the online. Very good evening to all of you. Indeed, it's a great honor for sharing this Thursday musing webinar. I am from Tirunelveli, is near Kanyakumari, the southmost part of India, and my co-chair is the Dr. Abdul Majid. Is from Srinagar. We both are from from North Pole and South Pole of India. So this Thursday musing is connecting North Pole and South Pole of India. Thank you very much for giving this opportunity. We know that the societal attitude toward the doctors has changed now, and each of your patients, their relatives are a potential litigants. And it is a great privilege for me to introduce Dr. B.N. Ravish. And he is not only a psychiatrist, but also a law graduate. And Dr. Ravish is the professor and head of the Department of Psychiatry, Mysore Medical College, Mysore. And also he was a former director of Dharwad Institute of Mental Health and Neurosciences, Dharwad. And he was held many positions in IPS. He was the past president of Indian Psychiatric Society Karnataka chapter, and he was also ex-member of the Karnataka State Mental Health Authority, and he was a nodal officer for the National Mental Health Program of North Karnataka, and he was also a member of this chairman of legal subcommittee of National IPS in 2019, and also he has done his MD from this Mysore Kasturiba Medical College, and also he has done his LLB degree from the law school from Bangalore, and also he has many awards to his credit, and he was a young psychiatrist of the WPA thematic conference of Degron, and he got a young psychiatrist award from the IPS Karnataka state branch, and he has presented more than 250 papers at the state, national, and international level. And also he has more than 82 publications, national and international journals, and 4 chapters in the International Psychiatry Textbook, and also 3 books in Canada he has wrote. And Dr. Avis is the right person to talk about preventing and handling the litigations. My co-chair will introduce about the topic.
Yeah, thank you, Dr. Sylvan, for a nice introduction of our dear friend Dr. Ravish Gowda. I am sure that most of the people on the panel and who will be joining later on very well know about Dr. Ravish and his contribution to psychiatry, and particularly forensics psychiatry, which is an upcoming branch, I would say, in the specialty of psychiatry. And particularly the way the mental health services are in India. And we know that there is an 80%, more than 80% gap between the patients and the mental health care services. So in that background, the Mental Health Policy and the Mental Health Care Act of 2017 was conceived, particularly keeping in view in perspective the individual rights of it was mostly patient-centric, and autonomy was the main crux of this Mental Health Care Act. So it has many, many positives, but at the same time, if we look deeper into it, in fact, the caregivers and we people, the mental health care professionals, have been actually presumed to be the main violators of the care of these patients with mental illness. And this is purely a right-based legislation for the patients. It has definitely changed the equation, I would say, be it the setting up of mental health establishments in India, as well as the mental health care per se. The patients with mental health illness, particularly the severe mental illness, you are liable to litigations. So in this background, I think Ravish Boss would be the right person to deliberate upon how to protect yourselves, and if you are caught up in a litigation, how to get out of it. I think he's the right person to tell us and teach us what and how to do and how to protect yourselves. I think that is the main aim of this presentation, and it's very practical. And Dr. Ravish, it is over to you to deliberate upon the topic. I know that, as the earlier chairperson said, we are from Kashmir to Kanyakumari connected today. I'm sure the people from Kashmir to Kanyakumari would be definitely benefited by your talk. Over to Dr. Ravish.
Thank you, Majid Bhai. Indeed, it's a great pleasure. Since I had some problem with the
Ravish, hope everything is all right. Are you there?
Sir, unmute the audio, sir. Ravi, sir. Ravi,
Sir,
sir.
unmute yourself, sir. Ravi, sir.
Ravi, sir, your audio is mute. Yes.
Hello.
Yes, now
Yes.
is on.
Okay. I had a problem with the other PC. I checked, and that's why I shifted to my laptop. Sorry for the inconvenience, and I'm really happy that I've been shared by the whole length of India. Majid Bhai, thank you for the introduction. And Panirana, you have been the southernmost tip. And I'm thankful to Tufan Patti sir and the two mascots, not the three mascots, because one is a senior. So Alim Bhai and Amrit, they have been doing wonderful by these Thursday musings. And I think it will go to the records of Indian, continued medical education program. I would straight away go to my presentation. I'm just trying it to make it a slideshow. Okay. Are you able to see it completely?
Yes, sir.
Okay, thank you. So this is one of the most neglected part, not only from the perspective of psychiatrists, but medical professionals in general. In fact, this motivated me to take up LLB, LLM, and then a PhD in mental health law, policy, and legislation. Because I have seen many doctors facing difficulty as expert witness. Forget about being just victims of some of the litigations, but as a expert witness, they had the difficulty. So, with this background, I will try as much as possible to give a bird's eye view because we are so engrossed with the Mental Health Act and now with the new Mental Health Care Act, we forget that we are basically a medical professional and we are bound by all the laws that deal with the medical jurisprudence. So as a legal action, please understand, we need to have a disclaimer, which quite often we forget because we think we are trying to do good to the society. But unfortunately, 21st century, I keep repeatedly telling, 21st century is driven by two things. One is human rights. Second thing is consumerism. And everything has to be mentioned beforehand. And it is universal. So this presentation is only an outline. It is not in-depth guidelines. Okay. And you need to get appraised in a state and federal structure of India because India varies quite hugely length and breadth across the state. Okay. And let me tell you, health is a state concept. Okay. I'm sure federal structure has certain national programs, but primarily it becomes the state subject. And some of the issues are in the concurrent list of the Constitution of India. So please be aware, even though you are ignorant about law, but law will not permit you to get away from its consequences. So whenever you have any issues, kindly approach. There are many doctors. Okay, I'm telling MBBS, later on who have done LLB and who are practicing medical legal cases. I have seen many specialists like OBG and surgery who have done law and who are now fully into the medical legal practices. And every society has its own legal committee and has its own what you call protection schemes. So with this disclaimer and caution, I would like to go into the subject matter. See, when it comes to India, I should be honest in telling the indications we get is very confusing because each state high court, they give a different set of judgments which are quite confusing. Let me tell you, I was going through some of the degrees. See, the Madras and the Marathwada would give MD obstetrics and MD gynecology. Do you think obstetrics cannot practice gynecology? And in one another judgment by the court, an MBBS person needed to conduct an cesarean section. But there are some kind of case judgments where a general medicine MD, when he went to treat a cardio MI, okay, cardiac arrest, so he was penalized because he didn't refer that case to a cardiologist. So let me tell you, don't get perturbed by these kind of judgments. As we go on with the presentation, I'll be able to clear some of the issues. See, this is not as clear as that as ABC, because like law, medicine also an inexact science. What was legally appropriate 50 years ago may not be legally appropriate now. Post-COVID, we now practice digitally and teleconsultations. So it has totally opened up a new paradigm. So that's why I'm telling you, it is quite confusing. And what we need to understand is, let us keep abreast with the latest development, not only in medical science, but the law of land. Why there is increased litigations nowadays? Mainly because the doctor-patient relationship has changed. Now it is more contractual, fiduciary. Okay, gone are those days where Vaidyo Narayana Hari means doctor knew the best. There was this family doctor. All those concepts are gone. Everything has come down to a kind of understanding what needs to be done and what will be the chosen by the patient or by their relatives. Well, I don't mean that medicine profession has eroding. It's been there with every profession. Okay, we have, I'm sure Panirana knows that every district now is coming up with a government medical college. Okay, I mean, disproportionately, the medical colleges are increasing, but the patients in the rural area are not been having the proper care. The teaching methods have changed. Now we don't have MCI, we have a NMC, which wants to bring in CBME, competence-based medical education, which has its own advantages and disadvantages. Now, everything has come to commercialization and consumerism. The corporate setup is playing a huge role in medical delivery. And these corporates are not doctors, let me tell you. And all the laws are really victimizing those doctors who have a small scale hospital and who are trying to do their best medical services to the society. And you all know the way media trial goes on and the way the WhatsApp and the social media is actually provocating, not actually creating awareness to the patient, but they are provocating. And we all know the technological developments in medical. We have e-care, e-consumerism, and e-manas has started in Karnataka. But still, there is always in a wide populous country like India, a adverse doctor-patient relationship. And the expectations from the doctors are unimaginable. I should tell you one case from Maharashtra where Rajaram Parab versus Desai, where the court said that if anything goes wrong, finally, in the process of medical care, finally blame it on the doctor. This is the way there is a litigationist tendency in the patients, whether it is 80 years old patient or a 20-year-old or an adolescent. This is how the expectations are there in India. I'm sure every one of us would have been experiencing these kind of expectations, miraculous expectations. In fact, many courts have said doctors are not magicians, doctors are not insurers, doctors are not guarantors. But still, there is some kind of expectation that doctors shouldn't take more fees and 24/7 they should be on service to the society. Anyway, I'll leave it to that for the discussion. I just want to show a small video clip. This is maybe around 3 or 4 years old. I was just curious, and in between I took a copy on my mobile. So the video quality may not be clear, but I just want you to just listen to it.
हीरे जैसी लड़की ढूंढनी चाहिए, just like a diamond. That's right. बिल्कुल आपके नेकलेस के बड़े-बड़े डायमंड्स की तरह. कौन छुटा? इतना महंगा सेट. तुम्हारी कोई लॉटरी लग गई क्या? लॉटरी ही निकली है समझो. एक्चुअली मेरे हस्बैंड का अपेंडिक्स का ऑपरेशन हुआ था और डॉक्टर की नेगेटिव्स की वजह से उन्हें इन्फेक्शन हो गया. इन्फेक्शन ठीक हो गया. हमने डॉक्टर के खिलाफ केस कर दिया. सेशन से पूरे 25 लाख रुपए देने पड़े. That's awesome.
Imagine a group of housewives discussing in a kitty party what will happen to the poor husband, and he will be provoked to consult a lawyer and falsely become litigious. Of course, the court has been very clear that you can't frivolously apply a case. I'll tell you, one of our Karnataka judge, A.S. Bopanna, has been elevated to Supreme Court. In the very recent 2022, okay, Harish Kumar versus Dr. Harish Kumar versus, okay, one of the patients said that just because there was an error, that doesn't mean doctor was negligent. Please understand this. And very famous judgment, that is Jacob Matthew versus State of Punjab. Okay, we all know just because there was a death, that doesn't mean doctor was negligent. So don't hesitate. Don't be what do you say? Don't be regretful. I should say regretful, because I have been into many of these discussions where people say, I discourage youngsters joining into medical profession. That's very bad. See, as professionals, we should encourage our newer generation to come up and then uphold our ethos. Okay. Now, I'm telling you, many people say, okay, the lower court will give some judgment, and once you go to the higher court, the judgment will be different. And hey, Kath, I will take care in Supreme Court. It doesn't happen like that, because judges are not technical people. It all depends what kind of evidence that is produced in front of them. That's why, see, when it comes to medical science, if a case of typhoid is diagnosed in a PHC, that will remain a typhoid even in a district hospital. But it's not the same in legal perspective, because the evidence, that's why there are certain things that every medical professional, not just psychiatrist, every medical professional, irrespective of specialty, they need to take up certain precautions. So uncertainty is there both in law and medicine, and it's constantly evolving with the invent of science and technology. And every case is unique, just like every person has certain unique characteristic. We all have a thumb imprint, fingerprint, which is unique not only for all the people who have been born, who are existing, and who are going to be further born on this earth. Just like that. So the cases are very specific to the situation and context. With this, I have still not come to the topic. I have been trying to sensitize you that law practice or medical jurisprudence is not like a seminar what we discuss during the post-graduation and the consultant's presentation in our teaching hospitals or medical institutions. What are the laws governing with regard to medical legal aspects? I'm just giving an overview. I'm not going into the details like, okay, you have to take the establishment license, the Mental Health Care Act registration, the corporation clearance. If you are using a lift, okay, the protection regard to that. I'm not going to all those multiple aspects. I'm just going to tell you in what headings you may be penalized, or you may be brought into the register of the law. First thing is compensatory. If you have done something wrong, then there are civil courts. More than that, under Consumer Protection Act, under Section 2, okay, they become consumers. So they will be under Consumer Redressal Forum at the district, state, or national forum, depending on the amount of compensation they call. The second thing is law of tort, which is a wrongful act. For that, compensation to the damages. Second thing is criminal action, punishment, punitive actions under Indian Penal Code in congress with the Criminal Procedure Code. Then disciplinary action. One thing I'm really, unhappy with the way the state medical councils act. I'm not sure whether they are really from the medical fraternity, because any complaint, they never scrutinize, they never screen. They will just send a notice to the individual doctors. And by the time you get rid of this, it will be 1.5 to 2 years. Imagine the amount of stress you have to undergo with all the daily routine difficulties and the duties. So many of them just want to trouble you by filing a complaint to the State Medical Council. Finally, it comes to the recommendatory statutory bodies like complaint before State Human Rights Commission or the National Human Rights Commission. And our patients, many of us would have experienced, they would have written a letter to the governor of the state, prime minister of the country, or to the president of India. Okay, and all the copies would be forwarded to the state governor or the health minister, and then it will come. Of course, it's all under the delusional network, but still you have to go through all these kind of suffering. Okay, what are the common medical errors done by the professions? Let me tell you, it's not just limited to India. Even the most developed countries like US, the third cause of death is by medical errors. It's next to cardiac mortality. Imagine. And in India, the latest what I could get is 5.2 million difficulties happen because of medical errors. What is the main reason? Whenever there is some kind of medical challenge, we tend to avoid that kind of patients. We need to communicate. 70% of litigations are due to miscommunication. Please understand this. And psychiatry is wholly dependent on a communication, the therapeutic relationship. And we are uncomfortable dealing with people who are very objectionable, questioning, and who have some kind of awareness from the social media. Something we need to set a limit, draw a boundary. Second thing is defensive medicine. We tend to do a lot of investigations when it is not required. Or we tend to ask them to run around, take an opinion from the medicine, take an opinion from some other, either a psychologist or some other person. So, this I'm telling as a part of a team or a medical institution. But in private practice, we tend to be more biological. We tend to ask more and more investigations. I have seen many people asking EEG where there is no indications. I'm sorry, I'm not being critical, but let me tell you, one case can spoil our whole career. And defensive medicines can become a malpractice. So as I was mentioning, 70% of our litigations are due to failure in communication, failure to diagnose. Most of our cases will have ambiguous diagnosis, but when you go to the court of law, they're not bothered about the diagnosis. They're bothered about the way you have approached to the case, whether a reasonable and prudence judgment in tackling the problem was approached. Failure to identify a complication. Okay, most of the time we have seen a multiple combination of pharmaceutical agents, psychotropic medications are prescribed. Okay, there is an antipsychotic, there is an antidepressant, there is an anti-epileptic, there is a benzodiazepine, whatnot. Okay, maybe it may not cause that much of a damage as a wrong surgery done on a patient, but still, of course, with the indemnity insurance coming to the uh, safety of our professionals, doctor, medical professionals, we have ABC category. But still, for a psychiatrist, let me tell you, okay, usage of an inappropriate drug, I have had to give expert opinion with regard to wrong usage of a psychotropic drug in a wrong age group, where a claim of 2 crores, let me tell you, until now, in the history of Consumer Protection Act in India, 11 crores has been the highest amount. So when we plan about taking the indemnity insurance, one need to be careful about the way we take the risks. Inadequate follow-up. Okay. So it's not a problem of doctor, but still we have proxy visitors coming up and then asking for the prescription. This is something I wanted to highlight. Second thing is, I have seen many psychiatrists telling, I am seeing more than hundreds of cases in a day, private practice. I don't know how they practice more than 100 cases in a day. Are they really giving that much of time to the patient? Because whenever you give less of a time, when the patient feels you're not heard enough, that is one of the reasons why patient will go to the litigations. And of course, there are many prescribing errors. Nowadays, we have electronic prescriptions. So that's one of the needy and supporting help from the technology. So whenever there is a negligence, we all know the 4D. One is there should be an duty of care. Second thing is there should be a dereliction of the duty. Third, it mentions direct causation, but not all the time it will be a watertight compartment. There can be indirect causation, provided that because of your dereliction of the duty, the damages were exaggerated or impounded. Okay, so one need to be careful while correlating with the causation. And finally, there should be a damage that needs to be proven. Now, usually in the legal terms, are you all with me? I'm just going on talking. So,
Yes, sir.
okay, thank you. So there are 3 levels of negligence. See, we all know there are civil issues and then there are criminal issues. When we come to the criminal issue, it is much more severe. That's why I'm more emphasizing on the criminal issues. So lata culpa, it's a gross neglect. Levis culpa, it's an ordinary neglect, and then levissima culpa, it's a slight neglect. It all depends on the damages caused by the dereliction of duty, and it will be determined by the place. See, we can't expect the same kind of law applying in a metropolitan city and a remote rural or a tribal place. So place, time, individuals involved, and the level of complications. Now, most of the doctors are not aware the steps in these kind of criminal procedures. See, a patient will go and give a complaint. That becomes a FIR, first investigation report. So police need not come and ask you. All those things may not happen. So they will, of course, there are many things that operate. So an FIR is filed. Let me tell you, when it comes to medical legal issue, the burden of proof will be on the plaintiff, that is the complainant, or the patient in this case. Next, once he files a case, a lawyer will have to defend on his behalf. That is wakalatnama. Then the investigation starts. Suppose if the patient has died, then the police will come and then do all the majar, postmortem, all those things. But let me tell you, under Jacob Matthew versus the state of Punjab, see, no doctor will be that, what do you say, the cola will not be done. Okay, they will not be arrested like the usual ones, because no doctor taking the oath will ever cause a damage. Please understand this. And there are instances where police have violated and they have been reprimanded by the court repeatedly that you can't treat a doctor just like any other criminal. Please keep this in mind. And you have all the rights to ask the police why they are doing so. And you can file later on. Of course, you would have suffered a lot, but still assert yourself. Don't be a victim. Don't be a mild recipient for all the malicious intention of the society, because doctors are a soft target. And in our medico legal teaching, every patient coming into a consultation room is a potential litigant. Don't have this soft corner. Doctor साहब आप भगवान हैं, ऐसा कुछ नहीं होता. All those days are gone. Please remember this. Keep your sentiments away. Be objective. This is what I wanted to tell you. Then the charges will be laid by the police, of course. Fine, let them do it. Okay. Then there will be an inquiry. And there are many instances that neither the police nor the court can just, expect, okay, or project that such a failure or omission has happened. No, there has to be a factual evidence. Until then, they can't just prejudice or predict that this might have happened. Okay. And sometimes there is a chance that, okay, in the usual criminal cases, whether someone pleads guilty or not guilty. Of course, we have to tell that we are not guilty. We have followed up to the guidelines. You have done to the best interest of the patient. Okay. Finally, the arguments and then the judgment will come out. And let me tell you, under the constitutional article 226 and 227, even though the consumer court has given a judgment that you need to pay so much, that doesn't mean consumer court is independent from the usual courts. You can appeal. Only thing is, it all takes time. See, law is so slow, and earlier it was negative. Until unless someone moves the court, it would never move. But now court has become, law has become proactive, and so amount of cases will come up. But you don't have to worry. The question is, there are many a time courts or the authority would play to the crowd. All you have to do is, if you have followed the standard procedure, if there is a national guidance, follow it. If there is no national guidance, follow the international guidance. If there is no international guidance and then still you wanted to do a beneficial act to the patient, there should be a scientific backup. That's all. Now, the most important thing, the most severest form and the core of medical litigation is the criminal malpractice. Of course, the murder, whenever there is a death. But still, there was no intention of killing the person. You have tried to do your duty and provided there is a gross carelessness and treatment, then 304 will not apply, 304A will apply. But let me tell you, no lawyer will put a single section. He will always go on add so many sections. Not only IPC, there will be some criminal procedure codes also. I don't want to scare you, but I want to sensitize my colleagues that IPC 304A is the severest form, but there are other IPC codes like section 336, where it tells your act, okay, either act of omission or act of commission, endangered a life or personal safety of others. 337, causing hurt, and 338 is grievous hurt. And we know grievous hurt, I mean, IPC itself has certain limitations because it was under the British rule, IPC 1860, okay. But still, there have been a lot of amendments, which most of the doctors would not be able to, because see, we are worried about scientific developments. So we would not follow those things. But let me tell you, don't get bothered by all these other sections that will be implemented. Okay. Now, some of the codes which are beneficial to the medical practice, I will tell you, which are ingredient within the Indian Penal Code, that IPC section 52. We always act in the good faith. That is, our topmost priority is benefit of the patient or the best interest of the patient. Section 80. See, all of us will have a vehicle, two-wheeler or four-wheeler, that doesn't matter. But when we take it to the road, anybody can predict that there can be a chance of accident. So such kind of accident known to happen. Okay. So such kind of action can happen even in medical profession. Section 80 of Indian Penal Code mentions that the act is not intended to cause any kind of damage. Okay. And it is done in good faith and with a informed consent. Please understand, we all know that now many state commissions and many courts have emphasized that informed consent is part of the medical practice. So we can give many number of examples about that. 89, when it comes to child and inside people, of course, we all know that there is no McNaughton's rule in India, but IPC 89 gives an equivalent to that. We can use coercion in certain condition. Okay, so legal coercion is acceptable, and we all know Mental Health Care Act has now given some flexibility, of course, with mental health review boards and such kind of things. Certain procedures can be done without consent, like if someone is having difficulty in breathing, tracheostomy has to be done. You don't have to wait for some consent. Or we have some judgments when there was acute appendicitis. Patient consent was not needed. Okay, so the doctor could have gone very well. So such kind of judgments have come up. And we can break the confidentiality also. Okay, provided, that's what. See, the golden rule says there is no golden rule. So provided you act upon the best interest of the patient. And the second thing is in the greater interest of the society. Only thing is you need to prove that, or you need to disprove what the allegations have been made against you. Now, many people have asked me whether a private consultant or a private practitioner or a private institution has any bonding duty on the state. Yes, they do have. because your license has been given by the State Medical Council. Okay, so you, whenever there is a case, criminal case, you can't give a false evidence. So you can't give a false certificates or wrong diagnosis. Okay, fabricating, I'm not trying to confuse you. Only thing is, I'm just trying to sensitize you. You don't have to remember all these numbers and sections, but just be aware about such things. Don't give false evidence. I'm sure. Okay, please, your honesty should not be bought by anybody. Okay, that is what we take that oath. Okay, and many a times we tend to damage certain kinds of records. Okay, don't do that, because ultimately truth will prevail. Intentional omission, okay, by giving false information, so destruction of the documents. So there are many omissions. And see, let me tell you, until 90s, there were no doctors who were taken away their lessons of practicing. But come 21st century, there are many instances as short as 6 months to as long as 2 years. Their license have been cancelled. Their practicing has been taken away by the registrar. Please be careful about that. I'm sure all of you know about Sriram Lagu, Dr. Sriram Lagu, who was actor. Of course, for different reasons, his license was taken up, but still he didn't practice. He was more a film actor. Now, one of the important and core features of medical practice is documentation practices. I'm sure at this hour you may think alcohol, but it's alcoa. In Kannada, alcoa means it's a sweet from the milk product. There has to be an attributable aspects within the document. That means sign, put the date, and there should be a name and designation. Even today, in one of the oldest medical colleges in the state, I have no fear to disclose this. In my institution, when there is a house surgeon, he never puts his name. But when it comes to the court of law, they will always catch what these, what do you say, not so well formed, matured enough doctors, but they will catch hold of these kind of deficiencies in the case sheets, in patient records. Second thing is, of course, now everyone are using computers. Okay, otherwise, when you are writing, let it be legible, contemporaneous, but meaning there should be some kind of chronological order, the way you put that. See, many times some sheets are later on added. Such kind of things will not be taken up well in the court of law. It should be original, because I still see patients and patient attenders carrying the case sheets, inpatient particularly, to the lab, to the X-ray, okay, to scanning. And very well, of course, whenever it is a medical legal case, you have to send one of your medical staff, whether group D or group C, whatever. But many a time it will be the patient or the patient attenders who will be carrying the medical records. So the original will be lost, they will tear it, but you can't use a photocopy or a reproduction. Okay, so please keep it original and keep it as accurate as possible. And what makes a document? Everything. We have basic medical record and the inpatient, which has been prescribed by the, particularly in mental health practice, by the Mental Health Care Act. So it should include adverse drug events. Okay, many of us doesn't know, but it's a recommendation by the NMC. Okay, it contains all the records laboratory investigations, medical records provided by the patient. It need not be a original, but still a photocopied, but still keep it in the records. Informed consent forms. I still see blanket consent forms, okay, in most of the medical colleges. The second sheet is a blank sheet, but below either the thumb impression or a signature from the patient attendance. Such kind of things will not work. And for whatever possible misreactions or whatever side effects, okay, doctor will not be held responsible. Such kind of blanket consent will never be held responsible. And nowadays, we all know there will be a telephonic conversation between the patient and the patient attenders or somebody. Please document that. If there is an email, take a photocopy or take a printout, and then all these things will come handy if there is a litigation. Why I'm trying to sensitize you, I'm not trying to scare you people, because I'm sure once you get experience, you will be much more confident when you go to the court of law. But otherwise, like the way the shark is trying to attack, the plaintiff, solicitor, or the lawyer will try to attack you. And most of the time, you need to conduct well yourself. You have your own right, okay, when you are in the court of law. And if you have specific questions, I'll be happy to answer later on. Now, what are the major difficulties with regard to the documentation process? There will be missing data because of some reason we will not have. It's okay if you want to add on later, it doesn't matter, but you just tell that it was added later due to these reasons. See, no court will put a point blank pistol on your head, because they know that medical profession will have certain emergencies and then difficulties. Try to avoid missing data. And always, whoever, even if a nurse, I know, because there is a famous case, okay, where a nurse gave injection Lariago, that is chlorpromazine injection. It was orally advised, but she thought that injection Lariago need to be given, okay, which caused brain damage. So please write the instructions. Particularly, don't write CST, continue the same, or repeat all. Okay. Somebody thought like PCT, paracetamol, RPT was also some kind of a drug. I'm telling you, all these kind of things I have honestly faced, and then it becomes very difficult as an expert when you go to the court and you want to defend your colleagues. It becomes a huge embarrassment. Okay. Inaccurate or erroneous transcription of the values. See, sometimes you have to give back the investigation report to the patient. So when you are copying, well, now you have photocopies and then you can do. Even if you have to correct it, okay, don't please scribble and then put the white out, okay. And I have seen many a times when there is a cross reference, they will say, thanks for the reference, history noted. Where have you noted? It's not here that you need to note. Court will not accept that. And we all have that bias. 6 months later, when you're called, you can't see the patient say, I have treated this patient. It has to be a documentary evidence. Okay, please note it. Don't put it like a checklist and then a bullet points. Okay. And when records need to be corrected, it's okay. See, we all err. Fine. do not obliterate the previous data. Fine, put a wrong. I mean, there is a way of, cutting those things.
Dr. Ravish,
Your voice is not audible.
I'm not able to hear you.
The audio is not. Okay.
Not visible even.
So I think his net has stopped.
Hang हो गया लगता है, hang हो गया.
Uh,
We'll wait for him to join again. I think his net has come off.
It's back.
Yes, Ravish was. Yeah.
Unmute कर लीजिए आपको.
Dr. Ravish, unmute. Some problem with the internet.
Again, it has.
Are you able to?
Yes, Ravish was. You're back.
Okay, I'm sorry.
Please share your slides and.
Okay, okay.
Yeah, the net took a stay order on your proceedings.
Are you able to see?
Yes, sir. You can make it full screen.
Yeah, I'll just do it. Sorry for the inconvenience.
No problem.
Not at
It's
all,
a
sir, not at
technical
all.
glitch. Nothing.
Everyone is glued to the screen. I think we were on the documentation problem. The last line of the documentation. Yes, yeah.
Yeah. Okay.
Yes,
Fine.
sir, yes. You had completed this slide.
Now it's okay.
Yes, sir.
Okay, fine. So, let me tell you, there is something called vicarious liability. So, the surgeons earlier were not liable for their mistakes. Okay, it would come to the unit head. But now the latest law is that even if the house surgeon make a mistake, so their temporary registration with the medical council can be withheld. So please be aware that just because someone is a house surgeon, he has a license to make mistakes. Gone are those days. And the nurses will also be held negligent for their action, and the pharmacist also will be held for their negligible action. So the onus is diffusing because of the development of the newer and newer laws. Okay, this is something one needs to understand. Just because you are a unit head or you are a head of the department, all the blame will come to you. No, gone all those days. Individual problems will be tackled individually. Okay. Now, see, now we are shifting from manual documents to electronic records. But the question is, see, there are controversy. How many years we need to maintain the outpatient records? How many years we need to maintain the inpatient records? See, various judgments give various things. But 3 years for the outpatient minimum. But since we are having electronic mechanism and cloud storage, it can go up to many years. Have seen a mission hospital, a Christian hospital started during the British era in Mysore, which has document right from 1920s. And today it's a great cohort information for the research. So such kind of benefits are there. But what I suggest is your institution, of course, if you are in a private practice and a single practitioner, it's up to you, minimum 3 years. But when you are in an institution, okay, you have a bylaw or a standard operating procedure and stick on to that. And once there is a bylaw and which needs to be in the public domain, okay, you need to tell, you can't keep the bylaws within yourself. It's not a secrecy. The standard operating procedure means it is for the service provider and the consumer. So then it becomes all right. So you need to be careful about the software or the provider of this provision who is reliable, validated, and adaptable softwares. If there is an ability to copy or hack or retrieve, okay, all those things you need to be careful when you are using electronic methods of using the documents. Now, primary thing, 4 important things, like you have inspection, palpation, percussion, and auscultation, okay, which has been taught to us in the MBBS. First, examine thoroughly. Sometimes a humanistic touch, okay, just checking the BP. I'm not telling that it may be legally sufficeable, but still the patient will be comfortable, okay, checking the pulse or doing normal relevant physical examinations. Definitely will help you from getting into the litigation. Prescribe cautiously. See, you need to be aware what you are prescribing, okay, and write legibly. I have seen many doctors who can't read their own handwriting. Okay, of course, I had to write copywriting during my PG days because my handwriting was so bad. And finally, read it out. See, in India, we have a problem that there are many illiterate people, particularly when you are in government service. Okay, a tribal person or a remote rural person coming and telling, Dr. Saab, मेरे को क्या अच्छा है आपको मालूम है, please do it. But still, you need to tell loudly that, देखो भाई, this is the right thing for you. This is more appropriate. This is more affordable to you. The 4 A's which the WHO has mentioned. Never forget these things and document it. Because we all know if you have not documented, that means you have never done that. See, many a times what we do is when we go for a holiday, when we go for a conference, the first aid team cannot take a second aid team. You have to recommend it to a person who is equally qualified. A medical officer cannot become a psychiatrist. And everyone knows that medical mishap is part of profession, but have you deliberately been part of it? That is something you need to Are you able to defend your actions? Finally, something which you have to do and don't do during your medical practice, take consent. Sometimes a simple injection, you don't have to take a written informed consent, but tell that I'm going to put a needle. Okay, such kind of things. See, I'll tell you one example. When I 26 years ago, when I came back to this government service, my PG training had told me that whenever there is a cross reference, introduce yourself. So I would say, I'm Dr. Ravish, I'm a psychiatrist. Your doctor has asked me to see you for these reasons. And people would laugh at me, but still I continued these things. So that would help a kind of therapeutic relationship between the patient and the doctor. And that patient would come back to me. So please don't get perturbed by all these things, all these kind of practices. Record and maintain this record. Never deviate from the standard procedure. Whenever you have doubt, have the big heart to ask for a second opinion. It doesn't matter. It could be one of your colleague only. Okay. And most of the time, who is the villain? It's your own colleague. Okay, who will have to give some kind of a report. And let me tell you, there are instances where there are litigations. Reading a medical textbook, they have come and filed a complaint. Such kind of complaint will not be accepted in the court of law. It has to be proven. Okay, please understand this. Always give instructions, whether patient likes it or not. Simple things, take a time. Okay, and most of the time talking doctor. Okay, most of for psychiatrist, people call like that. It's okay, fine, but still do that. And you need to update your skills. Until unless you are abreasted with the latest, you will always be left what do you say uh, behind. There are many instances where the corporate hospitals are in big soup because of the advertisements they have given. Don't be adventurous. Don't waste golden period. Whenever, of course, nowadays, the first aid or the primary intervention has to be done, and then they have to be sent. Okay. So reference is very important. Never indulge with false certificate or false bill. There are instances from earlier Andhra Pradesh, Telangana and Andhra Pradesh, where the lawyer himself, okay, did this kind of certification for getting a divorce. I can give. And excessive investigations, when the patient can't afford it, definitely he will be invariably trying to be more litigious. Don't delegate to the unskilled workers. What are the defense for the negligence when there is no duty owned? I can give one example. So there was this family physician, okay, to whom the patient called and said he has a high grade fever. Then he said, you better consult a physician, particularly in a hospital. They didn't go to the physician, they took a paracetamol. So later on, they wanted to sue the family physician, but he was what do you say, saved, because that he had referred to the hospital, which the patient and their attendants didn't follow. So that means there was no duty between the family physician and the patient. So when there is less than 1% of chances, I don't think anybody can foresee such things. But when you are taking informed consent, don't put that, okay, 20 or 25% of chances as less than 1% of chances. Duty discharged again to the prevailing standards in the country or across the globe. Definitely good results cannot be guaranteed in medicine. Contributory negligence, we know that, see, I can give, there are so many TV ads where blood thinner and then hypoglycemic agents. So what happens is they take the regular medications from the endocrinologist, and then they end up with hypoglycemic brain damage, and then definitely the doctor will not be negligent, because it's a contributory negligence from the patient. Such kind of things will happen. Third party intervention. So whenever there is some kind of what do you say, so-called life coaches are there, okay, so-called lame counselors are there. So the thing is, you need to document that what you have prescribed. And Consumer Protection Act gives a limitation of 2 years, but still, see, there is no watertight compartment in legal litigation. So, but usually when a litigation happens later on, so the court will take into the cognizance that, okay, they have a malafide intention against this doctor. So usually, okay, maintain what I said, minimum standards and then minimum documentation. So finally, medicine and law both are uncertain science, but law has got an overriding goal, mainly because it bases its judgment on evidence, particularly in that particular time. Most of the time in our medical practice, we have seen a lot of senior people say, according to my experience, my knowledge, such kind of comments will not work. मैं हाथ जोड़ के माफी मांगता हूँ, please, in the current legal process, seniors will be dealt in a different way, juniors will be dealt in a different way, but never say, in my experience, I will say this, you will be in trouble. Okay. All you need is evidence, evidence, and evidence. And a doctor must always act in good faith and in the better interest of the patient. Of course, well informing the patient. You all know that substituted decisions are gone. It is only supportive decisions that not only in psychiatry, but in all specialty that is being followed. Prevention is better than cure was a previous century dialogue. Nowadays, prevention is cure. Okay, if you prevent getting into some kind of litigation, that means you are well saved. And documentation is the main vaccine to save you from all this litigation. This is one of the articles that I have written maybe around 4 or 5 years ago, preventing medical legal issues in clinical practice. It's in the annual Indian Academy of Neurology. Okay. So finally, don't think that every one of us can be Munabai MBBS because what matters is the circuit, which shouldn't become a short circuit. I'm sure with all these technical glitches and one-way presentation, how many of you have really, been following? I don't want your reaction to be like this, but I thought this is the basic information that I need to deliver. So, but I'll be very happy for all of you to individually ask me the questions so that I can try and answer. And once again, thank Thursday Mursings and Halim Bhai, Amrit, and then Tufan Patti Saab. The team has been doing very excellent job in psychiatry education. And my respect to the both chairpersons.
Thank you so much, boss. Thank you so much, boss. Wonderful, enlightening presentation. I think we are wiser now. We'll be able to say ourselves better. So we'll take the questions on the chat box, but before that, we'll go to the chairpersons, Dr. Selvan and Dr. Majid.
A very mind-blowing and very informative presentation, Dr. Ravis. It's a very nice presentation. As he said, there is a change in the social attitude towards the doctors. Before, the doctors were treated like a god in the past, but today there is a shift. Doctors are considered as a businessman and profit maker. As Dr. Ravi said, consider every patient and relative as a potential litigant. And our specialty is different from other medical field. We are treating the patients against their will and with a lack of insight. The current Mental Health Care Act 2017, which is a more patient-centric and right-based act, which is going to create a problem for a psychiatrist in futures. No human being is perfect. Even an experienced clinician can can commit an error. So we should aware and anticipate all the litigation arise in our practice and to know how to prevent and manage the litigations. I think that current litigation, the legislation is not adequate to protect the doctors, especially Ravi has to answer. The legislation does not cover the entire medical negligence. I think so. So as Dr. Ravi said, prevention is better than facing a legal suit. I think to minimize the litigation, Dr. Ravi said we should adhere to the Mental Health Care Act. We have to document properly, get the proper consent, and follow the treatment guidelines, either national or international guidelines, so that it can defend you in case anything else occurs. And you should always be patient-centric, keep the patient satisfied as far as possible, and keep the ways know how to defend in case we have come across any medical negligence. And I think whether we need to have a professional security insurance, I think so. It's better we can have it because we have to face a lot of legal issues in future. We don't know. So it's a very nice presentation. I can to my co-chairperson, sir. Pass on to the co-chairperson.
Thank you. Thank you, Dr. Silvan and Dr. Ramesh. It was wonderful. I think it was more of a teaching for us. Particularly, we know that doctors and psychiatrists are not law knowing, but we have to be law abiding at the same time. So it has become absolutely mandatory for us in the background of Mental Health Care Act that we know about different aspects, how treatment should proceed, what the procedures should be, what the practices, ethical practices should be. And most important thing, as I remember, that documentation. We sit in our OPDs and the resident or even the consultant has done all the hard work for half an hour, 45 minutes. Finally, he has forgotten to document an important sign of suicidality. And patient commits suicide, and actually, you are literally in a soup, you are in trouble. So to safeguard ourselves, I think documentation is the mainstay of protecting yourself from litigations in future. Second important thing I would like to, in fact, it's more of an inquiry from Dr. Ramesh that I would like to have get an answer, is that I was in my clinic and one of the family came and the patient was on treatment from my side 2 years back, and suddenly family came that patient is again in trouble, he's in distress, and kindly treat him. He is not right now able to come to the clinic. So they made me to have a video call, WhatsApp call, and I called him and I just gave the treatment because I knew the patient, I knew the family. So suddenly after 1 month or so, I found that there is a FIR in the police, and the police called me, the judge called me as an expert witness that you have given treatment to Falana, and he was in the prison at the same time. Once I had put him on the treatment. The person was actually in the prison the time I saw him on the WhatsApp call. I was not knowing that he is imprisoned because of some criminal activity. So we need to be very sure that what we are treating, where we are treating, where the person is, how we are treating, you have to document it, that I have not seen the patient. So forgetting to writing that I have not seen the patient, that will land up you in trouble. I had fortunately attended through video call, WhatsApp call. So I was not knowing where the person is, but I knew the patient. But again, Ravesh, I think you can make us wiser in this case, that if patient is not present, we need to ascertain the exact location or the place where he is. With these words, I would hand it over to the moderators. And thank you very much, Dr. Tufanda and Amrit Bhai and Alim Bhai, for inviting us, both Dr. Salvian from Kanyakumari and myself from Kashmir, for the 140th episode, and that too by Ravish Boss, who has done a wonderful, wonderful service to us today by teaching us different aspects of practice and procedures that need to be followed.
Yeah, I would like to say a few things about this case, Majid Bhai. First thing is, see, for 2 years, they were out of treatment from you. So that is one of the protection. Second thing is, by responding to the video call, you have done nothing wrong, because the doctor job is to do the best to the patient. That is fine. But as you rightly said, you should document that you have not seen in person but over the phone. I'm sure if the case is still going on, see, the judgment is left to the court. But as a doctor, I would say you have done the best possible job given the context. And it will be up to the patient and the guardians to convince the court why didn't they come for the regular follow-up. And second thing is, why did they all of a sudden make a video call to you? It's not your fault to defend why you gave a video consultation. It's absolutely fine. This is something we should never get perturbed and we should never avoid.
Thank you, boss. Thank you.
Thank you, sir. Thank you. Sir, a few questions. How to, when you are setting up a practice or when you're starting your practice or what we're doing, so first thing is what you talked about, high index of suspicion that every patient is a potential litigant. And to be balanced by the empathy and whatever traditional teachings we have to be taught. So I think there should be a balance between two. We should not become too paranoid and we should not become too relaxed that we are gods and patients are there to, and we'll be looked upon like that. So I think that balance has to be there. Should we try to screen the potential litigants, and what are the signs that a person or a family could be a potential litigant?
Okay. Very important question. See, rather than knowing whether they are going to litigate or not, the best thing is we need to follow the procedure. See, because we never know who will be provoking them to litigate. And second thing is, when you have a proper kind of repercussion in some kind of a threat within the city, okay, an open threat, unless you don't have to feel threatened that, okay, this patient will be a litigant. But what I meant to say is follow the documentation procedures. So when you come and say, okay, somebody is a somatization patient, he is a person who is unhappy and is going to be litigant, it's very difficult. We can't keep contemplating that who is going to be the very person who is a paranoid schizophrenic can be a best patient also. So it's very difficult to predict such kind of things. Human behavior is highly unpredictable. So what I meant to say is, as you rightly said, take the middle step, that neither you have to get into a kind of transference, okay, nor become more paranoid. So all you have to do is have that asthana in Munabai, okay, a kind of disconnected thing. Never have that relationship, okay. Please keep that difference. You never know, once they get better, they will bring fruits, they will bring sweets, but please be at a distance. Never become very friendly, okay. And this has been rightly brought up in our earlier Indian Medical Council Code of Conduct, okay. I think that is something we need to, these are all brought up by the experienced group of teachers. Okay. So please don't contemplate that who is going to be a potential litigant. No, we can't predict it. That's my final answer.
Okay. Thank you, boss. Amrit. Amrit, you are on mute mode.
Yeah, there's a few interesting questions. Like, so there is a question by Dr. Sobhit Garg. So it's about somebody prescribing carbamazepine to a patient and the patient having Steven-Johnson syndrome. So, and there's a corollary answer to this, where somebody has responded in a very, I like this. So that's why I put that the judge told that it is a 9-year-old female. He had prescribed carbamazepine. Patient had rashes. So even though the doctor had talked about the side effects, the proper dosing was done, the proper escalation of the doses was done, but the judge fined him 90,000 rupees. Why was it? The doctor told that it means that he knew about the resulting damage. It is the legal duty of a doctor to exercise due care, even though he had taken all care. So what is your comment about this judgment?
See, is carbamazepine still the standard prescribing drug? Earlier, when we were UGs and PGs, there used to be something called drug of choice. That drug of choice concept is gone.
Yes.
Okay. Second thing is, when you know this possibility of reaction, particularly in such a young age, and when you know oxcarbazepine has come into the market, see, the choice or the preference has to be given to the patient. Here, she is only 9 years old. Then it should be to the guardians. If the guardians, despite of knowing, have chosen carbamazepine because it is economical, then you are saved. See, this is what the key feature of defense lies. You may still prescribe carbamazepine, fine, but you have given all the other options and the parents or the guardians couldn't afford anything and they went for carbamazepine. Then you are saved. Otherwise, if you have not given the other options and you have straight away gone to carbamazepine, you will be penalized.
Sir, if carbamazepine is such
But
a
there is
bad
no, but
drug, why is it
oxcarbazepine,
marketed? Why is it licensed?
sir, guideline में है ही नहीं oxcarbazepine. So for a corollary to what you told, oxcarbazepine is not in the guidelines, sir.
Oxcarbazepine,
Valproate you can't give to a 9-year-old female.
no, oxcarbazepine liquid, if it is not in the,
Suppose it's a mood disorder, it's not there in the guideline, oxcarbazepine.
okay, if it is not in the guideline, okay, then
And carbamazepine is what you mean to say, Amrit? Carbamazepine is what you mean to say? Carbamazepine is there in the guideline and
Yes, and oxcarbazepine is not
not.
there. Yeah. Shobhit wants to tell something. We'll call Shobhit. Let him.
Yeah,
Shobhit.
Shobhit, over
Yeah.
to you.
Sir, actually, if we say Steven-Johnson syndrome, it's an idiosyncratic side.
Yeah.
So how a doctor can be held implicated, and it is not even present in more than 1% of case, the side effect. So if the guardian, the patient develops this idiosyncratic maybe like hypersensitivity reaction to it, so still doctor can be held liable for it.
No. Basically, you have to defend one. Was the carbamazepine the only option? Second thing is, have you disclosed the risk factors? And third thing is, have you gradually, the autoregulation of the carbamazepine has been informed to the guardians, and then it was gradually increased. And to stop immediately when the first rashes comes, and a kind of emergency service that you have extended, this needs to be defended. Like, even though there is a damage, okay, which is foreseeable, which they had given the consent for which you had extended that a immediate treatment would have been rendered, then you would be saved.
Okay, sir. Right, sir.
And Santosh Sripati, if you can tell the case that you describe here is actual thing, or it is a case demo sort of thing that you have put in for argument's sake. So Amrit,
There are a lot of clinical psychologists there, and there one question that has come. To what extent a psychologist need to give the details of therapy session notes to a patient who comes with right to information? How to go about giving the session note details to a patient's parents if parents are asking for it who died by suicide?
Okay. See, patient is the owner of their records. One thing we should understand. Second thing is, if the patient is minor, okay, so then the parents will be liable for that. And even if the parents are asking, is it necessary to disclose everything? Okay, that prudence or judgment the psychologist can have. If it is going to damage the patient's integrity, okay, so certain things you can give it to the parents, and certain things you can keep it as a process of your therapy, because the therapy needs to be going on until the outcome has to come up. Okay, the parents themselves can have a wrong motive. You need to understand that. So don't think that all the time, okay, the parents will act in the best interest.
okay.
Are you able to understand? And all your information to the court of law will be taken as a subsidiary evidence. The judgment will be based on the evidence and the arguments by the lawyers. Here you are acting as an expert. You are not the victim. Please understand this. There is a difference between a litigation against you, whereas you are acting as an expert.
Sure, sir. Sure, sir. Dr. Bikram Datta wants to ask, what if police also joins in roughing up, calling doctor to police station or threatening doctor in case of him being affected by party also? So how to defend that?
Always there has to be a written notice until unless it is a non-cognizable offense. Okay, I don't think Supreme Court has given that judgment until now, as we understand. So police can't call like that. And in case of medical jurisprudence, there has to be a kind of evidence by the expert opinion. Otherwise, the court will never penalize you. Please understand this. Court itself is not a technical body. It is one of your colleague, okay, who will be called as an expert. If it is a criminal case, still you can take your own lawyer, and without the presence of lawyer, you can refuse to go to the police station. You can refuse.
Okay. Thank you for telling that.
Right to be listened by the legal counsel nominated or represented by you.
Okay. Question by Niharika. Can a psychiatrist take online consultation for a patient who is under 18 years of age without he has come without parents, and parents are also actually not aware that the patient is seeking consultation? It can be online or offline, if I add also.
I think it is better to avoid. Don't be adventurous Don't think that you can help many people in the society. No, you can straight away have that choice and refuse it. If they want, let them come one-to-one. Okay. Because after 10 years, okay, there is some kind of leniency as far as the consent is concerned. Okay. So you can call one-to-one, or you can refer them to the nearest physically available medical officer or a mental health professional.
Okay, sir. Dr. Vasudev wants to ask, he is an MBBS doctor, but having worked under neurologist for 19 years and being a member of Indian Academy of Neurology, can he set up a headache and epilepsy clinic? Can he also see psychiatry patients as he has a long experience working under a neurologist?
No, no, no. See, there is something called simulus simulabi curator. Like will call, okay, I mean, like cures like. Just because you have been practicing something, you are not a licensed psychiatrist or you are not a licensed neurologist. I'll give you one example. A general medicine person, earlier also I told, who treated a cardiac MI, okay, with complication. He was sued because he didn't refer to the cardiologist. Until unless you are not qualified, please don't, your experience will not matter. Do you have that license? See, you can be a member to any association. Association is not a statutory body. Is IPS a statutory body? It's not a statutory body. So don't have this confusion. There are certain things which are very clear in legal, terms. I'm sorry if I'm very straightforward, but this is the answer you should be aware of.
Sure. Amrit.
हो गया 9:45 वाली बॉस को छुट्टी दे दो
Chairpersons and Ravish boss.
we'll stop.
There are many questions actually pending. Ravish boss, I think we have to call you again.
एक बुलाएंगे कुछ सेक्शंस कुछ इंपॉर्टेंट चीजें बात कर लेंगे ठीक है रवि सर आज एक ग्रॉसली हुआ है we can go deep into certain things.
No, definitely, because there are very pertinent questions that WhatsApp, the latest one. Sir, nowadays patients are sending message on WhatsApp, and if you don't see those message and patient commits suicide, that's not your problem. I'm sorry, I'm not inhuman. Until unless you put 24 emergency, okay, you have no legal liability. The doctor is a human being. Please understand this. This is something where doctors think that they are for society. No, until unless you put a 24 emergency, 24/7 services, you are not bound. And I'm telling you, please make sure that consultation hours is this much, and that's all. If you are not on duty, even if you are in the medical college or some kind of a hospital, they need to consult them. They need to consult the emergency duty doctor or the duty doctor on psychiatry call. Why do you want to take all the responsibility of the world?
Okay.
You're not going to change this world, the suffering. I'm sorry, I'm making it very clear because there is a confusion. I have done LLB, LLM, and PhD. That's why I'm telling you, you are not a society, what do you say? वो समाज सुधारक नहीं है. Okay, we have a limited resource and we need to work like that. And let me tell you, even abroad, okay, your 1 week of duty hours is limited. Beyond that, you have a life of yours. Why are you slogging? I'm telling you, most of our medical professionals, they are slogging. For what reason? You're not going to eliminate all the illnesses in this
I'm
world.
not saying for money.
Amit bhai,
Isna paisa.
then you are liable. You are liable. I mean,
Sir, one last quick question. How
Yes.
long to keep the OPD record? You have answered it. And are we supposed to keep the Xerox of OPD prescription? And if so, for how long?
But
no,
now,
no. See, I'll tell you, most of the private medical colleges, for instance, even in our government medical college, which is 100-year-old, they don't have a provision to keep OPD records. It is the onus of the patient. So if that is your hospital bylaw, it's fine. Okay, but it has to be your hospital bylaw. Somewhere it has to be mentioned that. Then it will be the onus of the patient. Otherwise, you will have to keep at least for 3 years minimum.
And for a straight standalone OPD?
Yeah, sure.
Uh,
nowadays you don't need to keep Xerox copies. You have so many softwares. You can just keep a photo and keep it in it. You can just scan it. Now the time of Xerox is gone. People are still Xeroxing. Then I think it has become very easy now. Maintaining records is not a very difficult job now. Just scan it and keep it. Even if Alim sees 120 patients, it takes 5 to 7 minutes to scan 120 pages.
The simple thing is, all you have to do is mention it clearly that these are your policies. Okay, you yourself have a constitutional right. So you're not going to keep this thing that is well informed, fine. And another thing is, many people think that a psychiatrist shouldn't have a CCTV camera because confidential, who comes and who goes, nothing like that. Put it CCTV surveillance, keep the CCTV camera, you're fine.
No,
Because
but
knowing
can we
where
keep it inside the chamber, sir? We can't keep it inside our chamber, no?
you can keep, no problem, you can keep. Only thing is, recording the audio, you have to take a permission, that's all. Recording the audio is a thing, different. I mean, these are the nuances our doctors doesn't know, honestly.
Whether we need a video recording of the consent for a problematic patients, whether you have to take.
That you can take the consent and then do it. You can do it, honestly. But without their consent, you can't record it. Having a CCTV, who comes and who goes, nothing wrong.
okay.
But you have to mention it in the public domain that it is under CCTV surveillance.
Sure.
Can you share us certain things which we can put in our OPDs? That these things, it makes us easier for us because we are a medical legal person. If you can just give a document.
No. See, the thing is, no. You only thing is, it should not be in conflict with the law of land. That means, see, certain things like confidential information that you can't do. So what you can do is, you can send me a copy what you want to disclose. I can definitely be helpful in telling you, okay, this can go there and this can't.
Policy of the clinic, I mean, Amrit, you want to say?
Yeah, I'm talking a policy of the clinic. Like our timings is this to this.
Yes, exactly.
If you can give us certain things which can save us from a lot of litigation. That's what I was talking about.
Put it honestly. See, that is how this ISO certification is meant for. Accreditation certification is meant for, because it describes what kind of services you are giving, and it can be displayed even in the website or social media also. But it shouldn't be an advertisement. It's only a services that will be provided. That's all.
Alim.
Yes.
Yeah.
Answer.
I hope I didn't confuse because I don't know how to put it in more diplomatic way, because I had to make it more clear to the what do you say, listeners.
Congratulations, Dr. Ravis. You have not been diplomatic. It was a very, you have presented very simplistically, although the matter is very complex. And it will continue to be complex. We'll be having doubts and debates about the autonomy of the patient, the equity of the patient, how we are deciding about it, the privacy of the patient, and the confidentiality, whether you can divulge it or not. And one can take the plea. I am divulging the privileged communication in the interest of the patient or the interest of the community. That can be done. But as you have told, everything has to be recorded. And what I believe by taken CCTV, it has to be CCTV surveillance has to be given. But when there is a privileged communication and you are recording it, it becomes a right of the patient exclusively. What is communicated by my wife cannot be communicated to the husband also, unless it is to defend the patient, save the patient, or to save the community. Nothing else you don't have the right. Therefore, why to record all these things? Recording something which you have to preserve. And another important thing one has to display. Everyone is telling now it has become easy, we will make it digitally secure. But any digital store is not secure.
Yeah.
First thing, if I am going to treat a senior minister of the state, and it is in my system, there will be many takers of that. And whatever I may be, my system may not be protectable. If FBI's files are being hacked, if Indian defense files have been hacked, who is me? Who is Ali? Who is Ravi? It can be hacked. So you have to have disclaimer that we are keeping it in this way, the records, and it is susceptible to all this destruction, including a thunderstorm. Including a thunderstorm, we are prone. Natural calamities like Odisha very much.
Yeah.
Every year, once or twice, they come and go there, like our father-in-law, from our father-in-law place. And there also you can lose. So one has to be very careful in displaying. But once you tell I am preserving the data, you cannot deny that I cannot present. Because I'm a simple doctor saying 10 patients, you have to keep it. In the hard form or soft form, that is your problem. But you have to have disclaimers that I'm keeping it for so many days. But if it's lost by some process and out of my control, then you are safe. Can establish that I have taken steps to preserve it.
Hand of God. Hand of God.
So it's a nice presentation and nice interaction also among so many members. And as Amrita suggested, we can split it and go on only one issue. Suppose in one session you discuss about the equity. That is quite important, which is dealt in normal forensics. And to be very honest, this right communication is same for everybody. Any person coming to me and telling me something which is a privilege, I cannot divulge it. If I am recording anybody's statement to me, I cannot do it without permission. I have to take the permission. So thank you, Ravi. You have made a complex thing very simple.
Thank you, sir.
Thank you very much.
There are so many questions left out. Amrit, कैसे सर को बुलाना है, but set कर लो.
नहीं सर, अपने ही सर है क्या इसमें?
Amrit, over to you.
So thank you, Ravi's boss. Thank you, Amrit sir, Abdul sir, boss. You were driving, you came home, and you were in the clinic. 3 places you covered up the museum. So from Kashmir to Kanyakumari, length, breadth.
I forgot for wonderful feat that you have achieved recently.
Credit goes to Tufan sir and Alim sir. I am just the clapper boy. So thank you for your support.
MS Dhoni behind the wickets.
Anyway, we had a great session. It was
It was great learning.
So we'll meet you again. Good night, everybody. Thank you so much.
Thank you,
Thank
sir.
you.
Thank you, Amrit, sir. Amrit, sir. Dr. Amrit, Tapan, sir.
Thank you, Selvan sir.
Thank you
Those was
very much.
Abdul Bhai. Ravish boss, many questions were unanswered. I think you have to come again because still people are not going away. And
Yeah, I don't mind. We'll definitely have. Sure.
yes, sir, we have to have because too many clarifications are pending. Abhi.
Definitely.
So
पढ़ाई
yeah.
जारी रहे.
नहीं सर लोग अपनी जान भी बचाना चाहते हैं.
We have to finally save our skin. That is important.
Yeah. So thank you all of you. Tufan sir, with your permission, can we close the session?
Yes. With thanks and giving time to Dr. Ravish to have a nice dinner.
Yes, sir.
Let us allow him to be spared of us.
Yeah.
Thank you. Good night.
Thank you everyone. Good night.